So if you're based in Nairobi, you're actually paid more than someone who's based outside Nairobi. But on average, it used to be like 150,000 Kenyan shillings, which is about now $1,200 by
Per
now.
month?
But $1,200. Yeah, that's how much we were paid during internship. Actually, what happens with the county government, it's that they try to slash their budget. So you see, there are people who've done a diploma in pharmacy, yeah, and they will be paid less. So they prefer to
Oh,
employ someone
oh
paid
my God.
less than the pharmacist who is expensive. That is what is happening. That's why now pharmacists do not have jobs.
In today's video, we have pharmacist Linda, and I'm so excited to talk with her today. I'm a pharmacist from Nigeria, and I'm always making content on pharmacy, the pharmacy practice in Nigeria. A lot of things have been happening recently, not just recently, but like it has been happening for a long time, especially for graduates in pharmacy. Like
Yeah.
we come out to the pharmacy world, and it's really not what we expected, right? So, in my quest to look at how the pharmacy world is, I started researching on other people, how pharmacy practice is like in other countries. And it's just always intriguing for me when I find some information. I would go on YouTube, look for pharmacists, YouTubers, just trying to look for people who I could relate to. So, and that's when on one of those days I stumbled on your channel and I was like, wow, that's amazing. I love the
Yeah.
work that you were doing. And I'm just like, I feel like I want to know what the pharmacy world is like from in Kenya as a Kenyan pharmacist. I don't know if this is a pandemic or like this is just related to the countries that I have seen so far. But I just really want to know what the healthcare system, like in terms of like the pharmacy practice in Kenya, what that looks like.
Thank you so much for having me. It's been a pleasure to actually collaborate with you. I really also thank you for the opportunity to come to your platform and talk about pharmacy practice in Kenya. So my full name is Linda Opanga. I am a registered pharmacist and I practice in Kenya. And this is my 4th year in practice. Yeah, so yeah, I know most people tell me I look like, yeah, you look like so young. If I start now with the journey of pharmacy in Kenya, and most times you'll see I'll incorporate my own journey into this so that it feels more personal. So, pharmacy practice in Kenya, first off, in the uni, it's 5 years. So, you graduate from high school, and then there's a category that, like, there's a way in which the universities usually choose. So, once you graduate from high school, depending on the grading system, so if you score an A plain, A minus, and I think B plus, that's when you can be able to take pharmacy. So once now you got your grades, you apply to the different universities. There are about, I think, 7 universities in Kenya which offer pharmacy, like pharmacy practice.
How many universities are there in Kenya? No, in Kenya in general.
I think more than 20. More than 20.
Okay, more than 20. Okay, so 7
Yes.
out of the 20. Okay. Wait,
Yeah.
what's the population in Kenya? Sorry. I'm sorry.
I think 45 million. I think as per now we are about 45 million.
Okay.
So I'm saying, let's say 7 out of 20 universities, of which I think 3 are in private, then the rest are in the public sector. So long back, we only used to have one university, which is the University of Nairobi, which used to offer a pharmacy degree. But then I think after, let's say around 2013, 2012, then other universities started coming up like, to offer the pharmacy course. So taking back, now, once you finished high school, now you're joining university. So it's a 5-year course, as I'd already said. And then you start with first year, second year, third year, fourth year, fifth year. So first year and second year, you're doing the preclinical, where you're doing your anatomy, biochemistry, physiology, and the different types of chemistries, yeah? So once you're done with that, you go to second year, the same thing, like anatomy, physiology, biochemistry. And then second year, we also used to do computer. So they just give you like basic computer do that as an additional course. Then after that, now you go to now the clinical years. So in the clinical years, you have third year, fourth year, fifth year. And this is where now you start doing now the clinical practice. This is where courses like clinical pharmacy is introduced. We have pharmacology, pharmacognosy, pharmaceutical chemistry, pharmacy law and ethics, and many others are introduced along the way. Then you also have biochemistry, you have pathology, you have many others. I can't even remember microbiology.
Yes,
but
that's all right.
Yeah, we are doing like a lot of things. So once we now go to third year, we are separated. So now pharmacists, we start having our own classes apart from the other people. So coming to the clinical, we start our clinical pharmacy in third year. So we do third year, fourth year, and fifth year. So during the clinicals, there's the theory and then there's the practical aspect. So the theory part, you just like the lecturers come to class, they give you notes, that's it. Then the practical aspect, this is where now you go to the ward rounds. And for our case in Nairobi University, I studied in Nairobi University. So we go to Kenyatta National Hospital, which is the largest referral hospital in Kenya. So we practice there. So what you do is we used to have our classes, and then after the classes, we have scheduled ward rounds. So they divide you into different wards. So like some people will go to the surgical wards, others will go to the maternity wing, others will go to the renal wards, so that you can interact with different patients. So what we used to do in the ward is you join, there used to be whereby we are only pharmacists, and then there's the grand or major ward rounds where you join with other medics. Yeah, so you join like other medics, like you can find like you have medical officers, surgeons and stuff, but there was only pharmacy related ward rounds where we were only with our lecturer. So we go case by case, look at the treatment sheet. You also look at the patient, take the patient's history and do all these things in the clinical aspect. So that's part of now the practice. And then in school, we also had like other projects to do. Like for my case, I was like the Nairobi University Pharmacy Students Association. I served there for, I think, 2 years, where the first year was the Secretary General, and then the other year was the treasurer. So I served in 2 years, and there's so much things that we used to do like as students, and other things that people used to do like are locums, where you're still a student, but you go to a community pharmacy, and they pay you something like, so you can make money on the side. So once you finish your 5 year, actually within the 5 year program, there's the fourth year. Like when you reach the fourth year, you go for attachment. So by attachment, I mean you're going to actually experience now this. You go to a hospital, you go to a community pharmacy, and you go to the industry for 1 month each rotation. So in my community, actually, I went there, dispensed medication to a lot of patients, did like a lot of compounding. Then I went to also Kenyatta. I also did my rotations in Kenyatta Hospital, where I was attending to patients, did a lot of compounding for medicines for the children. Then in the industry, I was at an industry called Ellis, where I rotated for 1 month. So you actually go and observe how people are making the medicines, how the QC or quality control, is being done. So after your fourth year, then you go to your fifth year, and this is the year that now you're finalizing everything, and then you graduate.
My number one question is, how many pharmacists were studying pharmacy compared to, let's say, medicine or like nursing? Then my second question would be like, were there foreign graduates, foreign students in your school, and like what countries probably would they, like mostly like from what countries? But I don't know if you can retain, or maybe you answer, or I should say all my questions.
Let me start with the first one because of my memory.
Okay. Yeah.
So the first one, you asked like the ratio of like medics to pharmacy students to nurses. So medics, like people who are doing medicine, were the highest numbers, more than 300. Then pharmacists, when we started first year, we were about 100. But then by the time we finished, we were around, I think, 48, because you know what happens along the way. Yeah. Then nurses followed, maybe they were around, I think I can say 50. And then dentists usually were the fewest. I don't know why, but they were the... I don't know why. Yeah.
Yes.
How is it in your country?
Okay, so for me, right, I studied in Ukraine. So I didn't
Oh,
study, yes, I didn't study my country, but even in Ukraine,
yeah.
dentistry and yeah, it's usually like medicine, pharmacy,
Mhm.
nursing, and
Yeah.
dentistry. And I
And
don't know
then
why that is.
dentistry.
And
Yeah.
looking back, I think that being in dentistry, I feel like it's amazing, like because there are so many texts, but
Yeah,
let's not go into
it
that.
is like it makes a lot of money, my
Yes,
goodness.
exactly. And sometimes I think, I'm like, oh, I wish I had more knowledge, but let's not go into that
I
today.
know, I know.
But
It's okay.
yeah, so the second question was were there international students in your school, and like what countries were more prevalent in like in pharmacy or like in
So when we were studying, actually, there were no international students, but the international students now come when you're doing the internship so that they can be registered in Kenya. But during our studies, like in my school, in my class, to be honest, there was no international student. Yeah.
like how much was the tuition fee for pharmacy
Yeah.
students, and what degree do you come out with? Like, is it B Farm? Is it FMD?
Okay. So for the school fees, we are divided into two categories, right? So there's the ones who have been sponsored by the government. So depending on the grades that I had talked to you about. So if you got an A, and an A minus, and you are called directly to like the pharmacy course from the university, so you're called directly. And then there's the other program which we used to call parallel program. So if you've scored maybe an A minus and a B plus, and then you don't meet the cutoff points that are required for you to study pharmacy directly, then what happens is now your parent has to pay. So for the government sponsored, I think in a year I used to pay, I think, around 30,000 Kenyan shillings, which is about $300, I can say, $300 for a whole year. So that's first
What?
semester, second semester, third semester. Yes,
Wow.
if you're government sponsored. And then the good thing about that is they also give you student loans. So like maybe if you come from a not so well off background, then the government can give you a student loan. Then you use it now to educate yourself. So they'll pay for you the school fees, part of it, and then part of it you use the student loan to pay. And also that student loan, you also use it to just cater for your day-to-day, like food, clothing, whatever it is that you want to do. Then the parallel program. So this people used to pay about $5,000 for the whole year.
Wow,
Yes.
the
So $5,000.
disparity.
You not, yeah, there's a lot of disparity, but yeah, so if you wanted to be a self-sponsored student, then you pay the $5,000. But if you are government sponsored, like myself, I was government sponsored, so I didn't
Oh, so
like
you're
spend
the A
so much.
student. A student. Wow, that's awesome. That's awesome.
Yeah, so I was able to be sponsored by the government, and that's how I got through my education. So I was even actually calculating the other day, like how much school fees was spent. It was like 150,000 Kenyan shillings thereabout, which is like $1,500. Then I look at this other person who's paying like $5,000 every year times five. That's
That's like
like 2.5
25,000.
million shillings, $25,000. A very big difference. Yeah, but that's how the system is in Kenya.
If 5,000 is for a government, because University of Kenya I want to think is a government institution. So how much
Yeah.
would a private, because I want to think private universities are more expensive, right? How much would that one be?
So slightly above that, maybe with $1,000 above it,
Okay,
thereabout. But
okay.
not so much difference between the parallel program and
Mm,
the private university. There's
private.
not so much disparity between the two. I think it's almost
Mm.
yeah,
That's
yeah.
interesting because here is different. I think because
Mm-hmm.
like the government there's subsidy on most government owned things. So like everything
Mm-hmm.
is mostly subsidized. So people who go to government institutions pay
Mm-hmm.
really less because the government subsidizes.
Yeah,
Yes.
yeah.
So and it's different from those who maybe get additional support or like scholarship
Yeah.
or like some sort of support is different. But there's really no
Yeah.
system
Much
where
different.
it's like yes. But when it comes to private university, like, you know how it happens there where okay, the government owners are paying $300.
Yeah.
And if you go to a private uni, you're paying like $3,000 or like here, or $2,500. So like there's always that difference there. So that's really interesting. All right. So after university, then you can continue from there. Like after university, what happens next?
Okay, so once you're done now with your university, you've graduated. So there's that period of internship. So internship, most people call it residency outside here. So usually it's 1 year. So 1 year compulsory, you must go. So whether you're a foreign student, whether you're student who's studied in Kenya, it's compulsory for all of us. So this is what happens. And I had already told you that there's one university, the University of Nairobi, which used to offer pharmacy alone. So the other universities that have come up are usually subjected to examinations. So we have two different types of examinations, which is stage 1 and stage 2. So for stage 1, this is done by other students from other universities. So if you're a foreigner, number 1, or 2, if you're studying in any other university apart from University of Nairobi, then you must sit for stage 1 examination.
Wow.
So stage 1, you sit for it before you go for your internship. And once you now go through the internship,
do you pay for that?
No, you don't pay. Actually, you are paid when you're doing the internship. When you're doing your residency, you're actually paid.
No, I mean for the exams. Do you pay for the exams?
Yes, you do pay for the examinations. So this is what happens. During the internship, you rotate in different areas. So in my time, we only used to rotate in 3 areas, like the industry, the community pharmacy, and the hospital. So industry was 3 months, hospital was 6 months, and then community pharmacy or retail was 3 months. But then after some time, the systems have changed in that right now, you do, I think, 6 months hospital, and then you do 3 months. You do 3 months of a level 1 facility, like a primary healthcare facility. You do for 3 months. Then after that, you go to now the industry, 3 months, and then you do community pharmacy 3 months. So that's how now it's been structured. So that I think they're trying with the universal health coverage that's now been going around. There was a Vision 2030, and I think to align with the SDGs. That's why the government decided that they're going to actually post pharmacists in the level 1 healthcare tier. So that's how the internship is structured right now. And then after internship, now you sit for your stage 2 examinations, which is now mandatory. So for the stage 1, actually, I forgot to mention, now you're being examined everything from your first year until your final year. So all your anatomy, biochemistry, physiology, pharmacology, everything is under that. Then when it comes to stage 2, I don't know why it's structured like that, but then when it comes to stage 2, this is where now you're being examined on what you've been doing in internship. Now, this is where you do now the practical aspects, because if you look at the way the questions are structured, it's actually practical. Like if it's the clinical part, they'll give you a patient case and you're supposed to answer that. If it's in the industry, they'll give you a scenario. Like pharmacy law, they'll give you a scenario and how you're supposed to go about it. So I'd say that stage 2 is more practical than stage 1. Stage 1 is more theoretical. Yeah. Wow. So that's what happens during internship stage.
Okay.
Any questions there?
Yes. So during the internship, right?
Yes.
So you only do 1 year training.
1 year.
You don't have any sort of like military or like any, you don't have this. Okay, so in my country, you first of all do the 1 year internship, right? Then you write exams. Then you go for another 1 year compulsory service to your country.
What?
Yeah. You go for 1 year.
Wow.
Yeah.
So you've already gone through that?
Yes, I did that last year. Yes. So you do, and
how is it?
So now you so you can be posted to a different I don't know how it is in Kenya or Nairobi, like a different state, or because we have like 36 states in Nigeria.
Yeah.
So you can be posted to any of these places.
Mm-hmm.
So you can be
Yeah.
thrown into one state you've never been to before. So you go there and you're posted somewhere, maybe like myself, I was posted to a hospital. So I stayed there and I had to work for a year. In this year, your salary is, so you know how much you get during internship? Let's say during internship, because we here are the value, our what do I call it? Our minimum wage is really low. So let's say you get about $180 during per month during internship. So during your NYS, during the 1 year service to the nation, you get paid like half of that.
What?
Yes.
Half of what you during your internship?
Half is even a bit too much. Maybe quarter or half if you're lucky. So you get paid from of that in your workplace. Then the government also gives you like is let's say a stipend every month. It's about $50 monthly.
What?
So, yes.
Don't have compulsory military training like the NYS.
Yes.
It used to be when my parents were growing up.
Oh,
That's when
they abolished it.
Yeah, they abolished it. So right now you go into the military if you want. There's no like service to the country or something like that. No, it was abolished. So you just do your career as you wish. So after internship, now you can go to whatever field of practice you want. Yeah, in terms of military pharmacy, actually, you must go through the internship first. And then if you want to be a military pharmacist, that's when now you apply. They usually advertise the jobs like every year. So you apply and then you go for the interviews. If you pass, then you are taken. If you don't pass, then it's okay. But nobody forces you to do community service. Yeah.
Oh, really? So, but now that they made it not unnecessary or mandatory, are there people who still go for service? Are there like benefits attached to it?
Yes, I have actually a friend who, like a very close friend of mine, who's doing military pharmacy, and right now she's been posted to Somalia, actually. So yeah, there's
You're being
benefits.
posted outside the country.
Yes, outside the country to do peacekeeping missions. Others went to Congo. Others are in different countries, but there are others who actually still remain in Kenya to do like you go and practice in now the KDF camps, like the military camps. And some you can go to either Kenya Army, Kenya Navy, or Kenya Air Force. So she chose Kenya Army, that's why she's being deployed like outside the country. But then we have now, you can do Kenya Navy, where now you work like in the water and whatever it is that they do, then Kenya Air Force. So it's different and it depends on the cadre that you want to actually settle in and do your work in. But yeah, that's about military pharmacy.
That is really interesting. So like from what you're saying now, this is for people who are interested in the military later. So they go through the 1 year. Okay, that's understanding. But for now in our country, it's like everyone has to do it. Like though it's not like military, I don't even know how to explain it. So it's like just 1 year community service. That's what they do now. Although like you have these 3 weeks compulsory training that you have in camp where you are being trained, but it's not really as tedious as it used to be in the past. Like in the past where they are being taught so many rigors, like how to. But anyway, that's just by the way. So I wanted to ask, during the internship, how much is it like the pay doing your internship in Kenya?
Okay, during our internship, average, now it used to also depend on the region. So if you're based in Nairobi, you're actually paid more than someone who's based outside Nairobi, because they look at the, let me say, the economy of Nairobi, something like that. Yeah, the cost of living. Because in Nairobi, it's much more expensive compared to others. But on average, it used to be like 150,000 Kenyan shillings, which is about now $1,200 by now. But oh, yes, $1,200. Yeah, that's how much we were paid during internship.
Is it?
Yeah.
Oh, okay, so who is paying you? Is it the people you're working for?
No, it's
The
the
government.
government.
Okay, the government pays you during your internship.
Yeah.
I'm sorry, like this is so culture shocking to me. What's the standard of living there in Kenya? What?
The cost of living. Okay, before then, like if I go like 5 years ago, 4 years ago, the cost of living was not that high. But right now, trust me, it's like our cost of living is nearing London because of taxes here and there, here and there. You know,
Okay,
we had general
okay.
elections last year, and then there's the new president who's coming with taxes. So everything is being taxed. So I was even looking at our fuel prices and those of London. The difference is like $2, something, not $2. The difference is like $0.2, 20 shillings, 20 Kenyan shillings. So it's like our economy, we are like being taxed like someone who's staying in
Okay,
London,
so
to be honest.
okay. All right. So if
Yeah.
I get what you're saying now, from the 1,200, how much actually gets into your pockets are like at the end of the day, like at the end of the
No,
month?
that's the net. That's the net.
You pay rent monthly, right?
Yeah, you pay rent
So
monthly. The average rent in Kenya depends also on the place that you're staying. But I can say there are places where you can pay 25,000 Kenyan shillings, which is about $200. So I can say, depending on the location that you're staying, the average rent starts from maybe $30, because I've seen people saying they're paying 3,000 Kenyan shillings for rent. So maybe $30 to about as high as you can go, maybe $4,000, depending on the area that you're staying. So there's also that disparity. But as a pharmacist, okay, as a young person who's starting your career, definitely you're not going to stay in a place
yes.
that's like $4,000 rent,
Okay.
even below your pay.
Wow.
So it just depends. But average, let me say, most people, like in my age, they pay about $250 for rent there.
So what really like takes like the money when it comes to spending in Kenya?
Yeah, the most expensive thing in Kenya is actually rent. Fuel, if you have a car, trust me, you'll spend a lot on fuel, especially if you go to work every day. Food is also expensive, or electricity is also expensive. Other than that, because after that, you also have to pay for your insurance, for your health. So you can either choose to pay the health insurance for the government. That one is a must, you have to pay. And then you can also go for your private insurance. Yeah, then if you have kids, you see also kids are expensive. So it also depends. But the most expensive thing in Kenya, I can say, is rent. Then followed by now these other utilities. Yeah.
So after internship now, and you have
Yeah.
to write this exam, this mandatory exam. Do you pay for this mandatory exam?
I think, I'm not so sure we paid. I cannot remember.
Okay, so is there like a percentage or cutoff mark for this exam?
The cutoff mark. So it usually is 50, I think 50%. That has always been the standard mark of the Kenyan practice. 50%. Yeah.
So now,
Yeah.
what does the work looks like? So now, say for instance, I'm done with my internship. I've written the exam. I passed the examination. Where do I go from here? How do I enter into the next? Is it like I just go apply to wherever, or how does it work in Kenya?
Okay, before let's go back like to 2015. So 2015 and how can I say 2015 going backwards. The government used going backwards now, 2015, 2014 backwards.
Yes.
The government used to post people directly, like once you finish your internship, they take you to one area, they tell you now you're going to practice in this area, and then they pay you. So we have different job groups. So you're paid according to your job group. Then after 2015, I think, or during devolution, we used to have the old constitution, then the new constitution came, where now we have counties. So after devolution of Kenya, now the health was moved from the national government to the county government. So right now it's the counties that employ people. And sometimes, sorry to say, but sometimes counties like cutting on the budget. So because of that, they're not employing so many people. So after internship, many pharmacists are actually jobless in Kenya. Many. I can say more than 400 pharmacists right now are unemployed in Kenya. Yes.
What?
You studied for 5 years, but you have no job. I can tell you for sure, for myself, I finished internship and then I had to stay home for 7 months before actually landing a job.
Wow.
Yeah. So the state right now is really bad. So you're educated, but you don't know where
No
to start.
job.
Yeah, in fact,
Oh,
we've been having cases of people committing suicide. So,
wow.
like, because, back home, your parents have educated you, and, in
Yes.
Kenya, a pharmacist is called daktari. Yeah, like doctor. Sorry, I use that a lot. So, a pharmacist has the title doctor. We don't do PharmD, it's not PharmD, it's BPharm. But after BPharm, you're given the title doctor. So, people at home assume you're a doctor, and they're
But
like, we educated you.
nothing to show for it.
Nothing to show for it. So there are cases of mental health problems, depression, a lot of anxiety, and joblessness. Like that's the order of the day. And we realize most people, like if you talk to someone who's younger than me, they're so bitter because, they do not know what to do. And most people are like, if I'm supposed to go back in time, I wish even that money that I was given, I would have invested in a business or something like that instead of studying for 5 years, earning this, and then I have no job. So currently, what I've seen people doing is they are considering opportunities abroad. So most people are now moving to countries like UK, Canada, Australia, where they want like pharmacists. So the situation is really bad, to be honest. It's bad. There's lots of unemployment. Not pharmacists alone, even people who did medicine, people who did surgery, nurses. And that's why you can see most people actually planning to leave the country and go abroad because there are no opportunities for them. Yeah, so after internship, basically now it's man for God for us all, everyone for himself. So if you land a role, well and good. If you don't, then I've seen some people now going to influencing. Some people have now gone to farming, like totally different things. You drop your title and you just hustle like any other person. Because to be honest, the situation is so bad right now out there. Yeah.
Wow, I'm
But
so sorry. This is wow. I didn't know that this was also happening in other countries too. This is so sad to me because I mean, like the pay, like to me, I feel like it's the disparity is really like far compared to here. So my question is, for instance, I'm sorry to cut you short. You wanted to say something, right?
No, just say it. Say it. It's
Okay.
okay. Say it.
I'm thinking, right? So is it that okay? The county cut off the amount, but like I'm trying to see this. Does it mean that there are enough pharmacists already working, or is that there is no space for pharmacists, or what is actually the issue, or is it that pharmacists cannot they feel very I don't know, for the lack of better word, insulted to receive such amounts, so they stay back at home, or what is actually the issue? Although like the remaining time is 1 minute 46 seconds, I don't know what we can do in that time, but like let's see.
It's okay. Let me answer this. So, actually, what happens with the county government, it's that they try to slash their budget. So, you see, there are people who've done a diploma in pharmacy, and they will be paid less. So, they prefer to employ someone
Oh my
paid
God.
less than the pharmacist who is expensive. That is what is happening. That's why now pharmacists do not have jobs. And if you go to those hospitals, if you go to the county hospitals, they always complain they're overworked and understaffed. So
This is the same issue everywhere: overworked, understaffed,
underpaid. Yes.
Oh,
yes,
God.
it is.
Oh my, this is really, it's really, really sad. But like, thank you so much. Like, I think we're already on time. Maybe we'll do a part. Let's see if you can take this.
Yeah, we can do part two.
The questions that you have in the comment section. Please make sure to follow Linda on our YouTube. I'll put it in the description box below. And you can always watch our videos. Very interesting, very educative. Thank you so much for joining me once again. Leave your comments. Leave any comments in the comment section below. Let's know your thoughts. And subscribe and give this video a thumbs up. All right. Have a good day, Linda. Thank you.
Okay. You too. Bye bye.